The hardest part of the cancer experience for me, I believe, was the uncertainty and the fear when you hear the word cancer. It's so scary, and the uncertainty about what to expect.
The biggest problem is that they really had trouble getting through the system sometimes, and finding someone that could get the answer, and that was hard on both of them.
The hardest part was to find out that she had cancer, and worse, to find out that it was incurable.
Quality cancer care has been available in our community for more than 70 years, since Dr. Enoch Calloway established a cancer clinic in LaGrange in 1938. He subsequently became a founding member of the Georgia Division of the American Cancer Society. He was followed by Dr. Hoke Womack and then myself in 1980.
At West Georgia Health, we understand the healthcare needs of our community and strive every day to provide area residents with exceptional patient care. Responding to our aging population and increased incidence of cancer, we will soon create the Community Cancer Center. This will be accomplished by renovating and expanding the existing cancer clinic to bring our effective cancer treatments, advanced technologies, and talented oncology professionals into one convenient location. We currently serve about 500 new cancer patients per year, and every family is at risk. As your local hospital, we stand ready to provide coordinated, critical services for every cancer patient in our 7-county service area.
At West Georgia Health, you will find some of the finest radiation oncology technologies available in this part of Georgia. In 2009, we invested in a new linear accelerator capable of better contouring the radiation treatment field to the tumor while giving less dose to the surrounding normal tissue. In 2012, we added software to allow for a totally electronic medical record. These enhancements are only the beginning of what we have planned to meet the cancer care needs of our community.
In addition to renovating the existing Enoch Calloway Cancer Clinic to house the expanding services, we plan to reverse the entrance of the building to mirror the entrance of the South Tower. This will create a welcoming lobby that will house an education and resource area, as well as registration, financial counselors, and a boutique with wigs and other prosthetics. New support services such as rehabilitation, dietary and complementary therapies will also help patients cope by providing families with assistance dealing with the added stress that a cancer diagnosis brings. And most importantly, they will receive care from people they know, healthcare professionals who live in our community and are fully committed to their journey to recovery.
That's where your support is, it's where your family is, and that's the lack of hassle factor of having to drive through a bigger city or getting lost in a parking tower when you don't feel very good. And then my son would know the people who's going to give him the local chemo, and it's just so much easier for him.
Ida was my only sister, and we were very close. So I kept in close contact with Ida while she was going through this period of devastation. I tried to do as much as I could to relieve her daughter from having to get off work. But I constantly stayed by her side and would take her various places that she needed to go.
Of course, the support we got came largely from our community, our friends, from the doctors and nurses that gave us the care here locally. It was different when we went up to Atlanta. We lost that same support. We didn't have a connection with the doctor that may live down the street or the nurse that's been a family friend for years. So we missed that going out of town.
I'm proud to serve as a cancer care navigator at West Georgia Health. My role is to support both the patient and their family in the process of learning about their diagnosis, to understand the treatment options available, schedule treatments, coordinate referrals, and answer questions about what to expect and what happens next. As a nurse and a cancer survivor, I understand how devastating a cancer diagnosis can be and how important my personal support is to families affected by cancer.
Wanda Lau here in LaGrange was so helpful. Even though I couldn't have all of my treatments here, she still acted as a navigator for me to help me and give me advice. She was very helpful.
The cancer care specialists have the highest levels of education and experience, but they treat every patient like they're a family member. I was always amazed when we were dealing with anyone from this system how they were a friend, a family. They acted like we were the only patient in all the world. They really showed true kindness and care and love when they were dealing with you.
The Community Cancer Center will continue to build for the future of cancer care in our region through a coordinated program of early detection, effective chemotherapy and radiation therapy treatments, education for the patient and family, complementary therapies, psychosocial support, and the combined knowledge of our excellent oncology professionals in our community and beyond.
I'm excited to lead West Georgia Health's oncology program during the coming expansion. In addition to providing direct patient care, I have trained at the top medical centers in the country, practiced in a small-town environment, and worked as a professor at a large university. I am also proud to have had the opportunity to manage my patients' participation in clinical trials. Through this experience, I have come to understand how vital local cancer care is to achieving the best outcome for each patient. Local cancer centers, such as ours, can provide the majority of care, with the big regional centers lending their expertise for rare cancers and specialized services. West Georgia Health's oncology program uses a multidisciplinary approach, and local cancer specialists meet each week to discuss the treatment path for each patient. I have made a personal commitment to this community and look forward to developing the oncology program at West Georgia Health into the outstanding regional resource that our families need.
I think the Community Cancer Center is a very important aspect of our healthcare system. There are many people that come from other areas to LaGrange for health care, and I think that having all of the facilities and everything under one building will be a great help to the persons who need the treatment and to family members.
I support the Community Cancer Project because it's really important to be able to get as much care as you can locally. We have great resources here. We've always had good cancer facilities here for years and years and decades, actually. It'd be a godsend to be able to have your family cared for here.
Certainly we support the Community Cancer Center. You know, these are awfully difficult times for anyone to go through a serious operation, but when you've got cancer, there are so many complications and fears that you're already facing. To know that you've got the best facilities, the best equipment, and most of all, the best people at your disposal here locally, I can't tell you how important that is to a family to know that they've got the confidence, they've got the support they need to get through some trying times.
We hope you and your family will never face a diagnosis of cancer. But if you do, West Georgia Health stands ready to assist you with the latest treatments and technologies and the compassionate support services we all deserve. Please join me in support of the Community Cancer Center and help create more tomorrows for our friends and families.